On top inside Edo today, Obaseki don yarn am say wetin past government don do on top Stella Obasanjo Hospital. He say this one no make brain at all. Edo State Governor Godwin Obaseki don yarn am on top Stella Obasanjo Hospital wey administrations wey don first rule for Edo State be abandoned, as e tok say dis kain mata no make brain, as e be say government don spend plenty money to see say dis hospital e tanda well for di state. Obaseki tok dis one wen e go do check on top di facilities wey dey Stella Obasanjo Hospital wey dey Sapele Road for Benin City. As e tok on top how body take pain am sake of say dem no maintain di things wey dem dey use take dey work for di hospital. E tok say im administration don see say dem put beta work for health sector, as e be say wetin dey affect health sector for di country na who wan pay for who go heal am. Obaseki kon yarn say dem don tanda Edo State Health Insurance law, di one wey dem don pass for bill and di matter don turn to law, as dis one dey make am easy for everybody wey dey Edo to fit save for their health matter dem, as dem don do dis one for di people wey be pension workers.
In undertaking the reforms in our healthcare system, I don't know if you know, just as we've done in education, we have been looking at the total restructuring of the healthcare system. We have built 20 pilot PHCs, primary healthcare centers, and with those pilot centers, we want to expand to all the wards in the state very quickly. The whole idea is that the main care will be at the basic healthcare level. We need to have referral centers, referral hospitals, where patients who can be treated at the basic healthcare centers will now be moved to. And that has informed us looking at where secondary care, quality secondary care, can be offered to citizens. You also realize that we have one of the main issues that confront healthcare in this country is who pays. Up till now, there's been no comprehensive system where people save for their health needs. So we've introduced and passed it to law the Edo State Health Insurance law, which makes it compulsory for every citizen in Edo to save towards their healthcare requirements, just like we've done in the case of pensions. But for healthcare, it's going to be everybody. Pensions is for those who are working in government institutions and parastatals. So with the plan in place, the challenge that that healthcare used to face in the past, which is not enough funding, enough capital to maintain infrastructure, to pay for quality human resources and human personnel, hopefully will be dealt with. And so for us as a government, you can't ask people to pay for this kind of quality of care. That's one reason why we're looking around to make sure that the basic healthcare centers provide quality care, and then the hospitals are referral centers. You can't come into a hospital like this in future to treat malaria or to treat basic illnesses. That should be taken care of at the primary level. So when you come in here, you're doing more, hopefully, diseases that cannot be dealt with at the primary care centers.
E come tok say body shook am well to see say dis kain hospital be dey, and di past government no try to improve am, as e be say dey come dey tok say dey wan build 5-star hospital.
I'm very disappointed. I mean, this hospital is less than 14 years old, and you can see clearly there's not been any serious work at maintenance. And with medical facilities, like most other public assets, if you don't maintain them, they'll fall apart. So I'm really shocked that if we had a facility like this, we didn't think of expanding it, of improving it, of upgrading it, and we started building something we call 5-star. I'm really shocked. I didn't realize that so much investment was poured here in the first place 12 years ago. Why we have not optimized them, I don't know. Look at the IC units that were just left to fallow. Today, they are unusable. I just spoken to management. We are looking at areas where there's duplication between this facility and General Hospital. You realize that most of the buildings in the general hospital are very, very old. We're looking at consolidating the services provided in the general hospital in this facility. So we'll pull down all of those old buildings and then get private investors to now come and invest in state-of-the-art, state-of-the-art facilities, specialized facilities like oncology, like cardiology, things that, at this point in time, our budget may not be able to support. That's the point. That's what we're trying to get at, such that we begin to deal realistically with this challenge of medical tourism. Some of those facilities that people go and receive treatments in abroad, we want to encourage them to partner with them so that they can set up specialist care here and be able to show them and demonstrate to them that those facilities will be viable because we will have enough data of patients and conditions from the primary healthcare centers through the secondary centers. So with all of that data, they will be able to make informed decisions as to what extent of investments that needs to be put into healthcare. But underlining it all is that they now realize that, okay, if they have facilities here or we invest in these facilities, somebody will pay for it. That healthcare is not going to be funded primarily from state budgets alone. Right now, people are paying. The issue is what is the quality of the care they are paying for.
Obaseki Council use this visit time to take talk to patients wey dey pediatric and women ward for the hospital, as e tell dem say lines dey ground wey dem fit use call government if anything dey do dem. Na here we see the ogbonge informate reach on top wetin shele for inside Edo today, as Governor Godwin Obaseki don talk and say wetin past government do on top Stella Obasanjo Hospital e no make brain, and dis kind thing e shook am for body on top health matter. Make una no forget say dis ogbonge informate so na T Live Media na im knack am come give una on top inside Edo today. And to continue to dey get ogbonge informate on top wetin dey shele for inside Edo, make una no forget to like, comment and subscribe for our YouTube channel for T Live Media TV. As na fit follow us enter Facebook, Instagram and Twitter on top T Live Media, and our website sidon berated put for www.tlivemedia.com to dey get ogbonge tori as e dey shele for Edo State.